and assalamu alaikum, ladies and gentlemen. Welcome to yet another episode of the Dental Talk. Today we have a very special guest, a senior of mine, Dr. Nurain Rehman. She's someone who I've always looked up to and have always been inspired by. She's someone who I've always gone to for support and guidance, and it's always been a help. For some of you who don't know Nurain, she graduated from the Institute of Dentistry at CMS Lahore Medical College back in 2017. She's now currently in the Surgical Implant Dentistry Advanced Trainee Program at the UCLA School of Dentistry. I remember she was a huge advocate of research during her undergrad years and had multiple articles published to her name, but that led her to become the editor of not one but two internationally recognized journals, one the EC Dental Science and the second the International Journal of Anesthesia and Clinical Medicine. She is also the editor of the book The Frontiers of Pain Science volume 2, that is to be released next year in 2021. And these are me listing only some of her achievements, and that's why I've always been so inspired of her. She had a lot to tell us, especially considering dentistry in a post-COVID-19 world. If you want to pursue dentistry abroad, so you'll have quite a lot to learn from her. So without further ado, Ms. Nurain Rehman. Hello and Assalamu alaikum, Nurain. How are you? How's the quarantine life going?
Hi, Jim. I'm good, and the quarantine life is tough, but just getting a lot of time to get a lot of things done that I
Right.
couldn't see. How is it going for you?
Alhamdulillah, can't complain. It's been a bit tough, but
Mhm.
I guess we're all just getting through it. I don't know
Yeah.
when life is going to get back to normal, if it's going to get back to normal, but let's hope for the best. That's all I can say. Well, so with your permission, should we start the interview?
Yeah, of course.
Okay. So just let's talk about you. Introduce yourself to our audience. Tell us a little about your journey through dentistry. When did you decide you wanted to be a dentist, and your journey through those undergrad years of BDS?
Right. So I'm Dr. Nurain Rehman. I'm a Pakistani dentist currently based in the United States. I graduated dental school in January 2018 from the Institute of Dentistry, CMS Lahore Medical College. And I'm currently pursuing a career in the oral and maxillofacial surgery in the United States. So, before joining dental school, my impression of dentistry was very different to what the reality is. And
Mm-hmm.
I think that goes for all of us when I say that. So, a couple of things that I learned during my dental school and what I really came to enjoy about dentistry is that, first of all, it's very hands on. We get to work so much with our hands, be it
Absolutely.
intricate wax work while fabricating dentures or composite or sculpting, composite fillings.
Yeah.
And being a kinesthetic learner myself, it's something that I really enjoy.
Mm-hmm.
Besides that, another thing about dentistry that I really like is that it is not just we when we think of dentistry, we think that it's just science and medicine,
Yeah.
but it is not just that. There's definitely an artistic element there.
Absolutely.
You know, from shaping composite fillings to realigning a whole arch, there's a lot of precision,
Absolutely.
symmetry, and cosmetics that is involved.
Mm-hmm.
And one thing that I think sets dentistry apart from medicine is that not only is it rewarding to, remedy physical suffering,
Mm-hmm.
but also to have your work act as a foundation on which a patient rebuilds their self-esteem. Because, we're
Absolutely.
improving a bit.
Yep.
I think that is amazing, and that's something that really sets dentistry separate from medicine.
Absolutely.
So, in retrospect, my journey through dental school was pleasant mostly. However, during my final year of dental school and my internship year, I was faced with some rather difficult moments and situations.
Mm-hmm.
So, I drew criticism for being career oriented and
Mm-hmm.
ambitious, and more so for my pursuit of surgery. Because
Yeah.
in a community like Pakistan, surgery is considered a man's line of work.
Yeah.
And it is unfortunate for me to say this, that this criticism was not inflicted by my peers,
Mm-hmm.
but rather the dental faculty. The
Okay.
very people who I considered my mentors, they would mock at me and constantly discourage me. So that was rather difficult, but I had two mentors who got me through that time. Dr. Samir Kazi, who was the head of oral and maxillofacial surgery at the
Yeah.
time. He is the bestest mentor I've ever had, and he was a constant source of support and motivation, and he believed in me to achieve my goals. And so he got me through final year, and then in internship year, Dr. Asad Chatta,
Yeah.
his encouragement words got me through my internship year.
Yeah.
So overall, it was a bittersweet journey, but
Perfect,
well,
perfect. So we'll come to Dr. Samir Kazi in a bit, but okay. So you've already answered the next question. My next question was that which specialty of dentistry excites you the most? But my next question is, why does maxillofacial surgery excite you the most?
right. So you see, all fields of healthcare and all fields of dentistry, whichever specialty you take, they all have a great impact on an individual or our patients' lives. But oral and maxillofacial surgery, as surgeons, we do work that is life altering, right? And
Absolutely.
that is the kind of work that is the kind of impact that I wanted to have through my work on other people,
Okay.
right? Besides that, oral and maxillofacial surgery is like the most holistic specialty of dentistry.
Yeah.
It is not limited to dental science, it involves a vast knowledge of medicine.
Yeah.
So, these factors, together with the fact that I was interested in the subject, led me to pursue the specialty. But most of all, why I chose this specialty is because I feel it aligns with my personality on a lot of levels.
Right. Right.
So, my drive for achieving any task comes from or is based on how challenging it is. The
Mm-hmm.
greater the challenge, the greater the drive, right?
Perfect.
Besides that, I'm quick on my feet. In stressful situations, I'm able to maintain composure and not
Mm-hmm.
panic.
Okay.
And even when there are sudden changes, I'm able to not be intimidated by them and I'm able to adapt,
Perfect.
right?
And all
Along
these
with this,
qualities, all these qualities are that one
along
needs to be a maxillofacial surgeon, right? These, to tackle situations, to not be bothered by sudden complications. This is what makes a good maxillofacial surgeon.
Exactly. These are the qualities that are needed inside the operating theater when you don't know what would happen next. There is
Yeah,
uh, not everything is planned throughout. You never know what could go wrong, and at the brink of the moment, you have to adopt a different treatment modality or
absolutely,
completely different way. Having
absolutely,
said also, surgery is a lot about commitment, having the mental and physical stamina for long working hours. Uh,
absolutely.
For me, my priority in life is my work,
Hmm.
and lifestyle sacrifices for my work is not something that bothers me.
Hmm.
Uh, so these are a few reasons why I felt that this
Perfect,
is really
perfect.
aligns with.
Perfect. Okay, so we still know that these are early years of yours as a dentist, but you've already told us how house job year was. But after you graduated from house job, you were done with house job. How have those 1 to 2 years been, and what do you think the future holds for you in the future?
Right. So to be very honest, after I graduated dental school and got done with my internship, it ever since then it has been a difficult time because it is the first time that you set foot in the practical and the real world
Absolutely.
completely on your own, right? Then I shadowed in multiple places in the United States and meeting people from different backgrounds and walks of life on the same path as you realize that the competition is just fierce out there. And
Absolutely.
it was intimidating. It was really intimidating. But at the same time, I think that fear, it also grounds you. It makes you more focused towards your goals, and it makes you more driven, and it makes you work harder. And that's what I've been trying to do in my past 2 years.
Mhm.
And I'm not sure what the future holds for me, but I really sincerely hope that it is a life that I've envisioned for myself and the goals that I've
Inshallah.
set.
Inshallah. Okay, so that's beautiful, just by the way. But okay, let's talk a little about research. You've been a strong advocate of research in your undergrad years. We know research is very important during your postgrad, but how important do you think research is during your undergrad years? And does it have to be a clinical research, or can it be any other type of research? Because you're an editor of two international journals, I'm sure you would love to speak about this.
Right. So, why I was a big advocate of research throughout dental school is because one of my mentors instilled its importance in me. Right.
Absolutely.
So we all know that research is basically essential for advancement in any field, right?
Yeah.
But at an undergraduate level, you even if you do research, you're not going to be proving a theory. You're not going to be able to find a cure to a disease that is not out there.
Yeah.
You will not finding a new treatment modality for a certain
Yep.
you're not going to be achieving and you're not going to be contributing to the advancement of the field, very frankly,
Mm.
not at an undergraduate level. So then why is it important? So see, the dental education system or the pattern that we have in Pakistan, it is limited to learning from a set of books dating back 10, 20 years,
Yep.
right? We're tested on
Absolutely.
that knowledge from those books, and our vivas are scored on how fluently we repeat those exact sentences back to our examiner.
Mm-hmm.
And all of that, being in that education system and being tested that way and examined that way, it narrows our vision. We become very narrow minded, and we basically we're just rote learning. We forget to use our critical and analytical skills.
Mm-hmm.
So
Yep.
research battles with that, with all of that. What
Okay.
research basically does is that it inculcates in you the ability to critically evaluate and analyze a situation.
Yep. Absolutely.
Important as a clinician to have those abilities,
Yeah.
right? Of course, besides that, it adds to your knowledge, and it keeps you updated with the right. Are you still there?
Yeah. Yeah.
Okay. And it keeps you aware of the recent advancements in the field. So that's why I believe that research is really important, to battle the kind of that tunnel vision that we have, to broaden that at an undergraduate level. And
Yep.
no, it is not important for it to a clinical research. It can be any kind of research. It can be any topic, clinical or non-clinical.
Right. Perfect. Perfect. Okay. So let's talk about BDS in Pakistan. What are the things that you most appreciated about BDS in Pakistan, and what are the drawbacks? Because I remember you being vocal about how we're falling short of international standard dentistry, and now I believe it to be very true. So let's just talk about what good there is in BDS in Pakistan, and what are the few drawbacks.
Right. So, one of the things that I really appreciate about dental education in Pakistan is that we have a lot of exposure to patients, right? And one
Mm-hmm.
of the reasons for that is that we do not have the dental insurance system, right?
Yeah.
As is present in the Western countries, which limits
Absolutely.
the exposure to different patients in different cases.
Yeah.
We are exposed to a lot of different cases. We are able to treat a lot of different patients, right?
Yeah.
And that basic, the increased hours of clinical training gives us a really good chance to hone our practical skills.
Absolutely.
So that is one thing that I think we're fortunate that we have in Pakistan. As far as the drawbacks are concerned, I think one I've already mentioned, that the pattern of dental education There is lack of practice of evidence-based dentistry, lack of attention to research.
Yeah.
There's one of those. Besides, one thing that when I compare myself and my time through dental school, when I compare that to students over here, so over here, a lot of attention is placed on diagnosis and treatment
Treatment
planning,
planning.
right?
Yep.
That is not the case with us, because in our intern year, I clearly remember everybody would be clueless. You know, we did not know how to diagnose a patient. Students did not know how to identify pathologies on radiographs. And
Yep.
frankly, we were just completely clueless about planning,
Yep.
right? And at the end of the day, if you're not able to diagnose correctly and you're not able to form an accurate or suitable treatment plan
Perfect.
for your patient, then no matter how good your practical skills are, it makes no difference.
Yep.
So students over here, they have really strong diagnosis and diagnostic and skills and treatment planning skills. And the last thing that I think is a drawback is that the environment
Yeah.
of dental education in Pakistan and dental fraternity as a whole in Pakistan. So
Absolutely.
our environment is not conducive to growth as a dental professional and even as an individual.
Mm-hmm.
I think there's a lot of unhealthy competition, and there is a lot of we're discouraged most of the time.
Yeah.
So when I,
Okay.
after my dental school, when I started shadowing here, what I really liked about dentistry in the US is the favorable environment. All the professors so motivating and supportive. And even though I was not a student, a regular
Yeah.
student in these programs, just an extern or an observer. But the way they encouraged me and the way I'm still in touch and in contact with these professors, it was just amazing. So the
Perfect.
environment is like very wholesome, and it's
Yeah.
great. And we don't have that, unfortunately.
Perfect. Perfect. Okay. So let's talk about your mentor, Dr. Samir Kazi. Dr. Samir Kazi, I know, has had a huge impact on you, and you worked really closely with him during researches and for clinical practices. But if you had to pinpoint how much has he actually impacted your understanding of dentistry, how did you change because of him? If you had to answer that question.
Right. So I became acquainted with Dr. Samir Kazi during my third year of dental school when he was the head of the Oral and Maxillofacial Surgery department at the Institute of Dentistry,
Yeah.
CMH. And ever since then, I have been very closely associated with him. Dr. Samir is not only a great educationist and an oral surgeon, but he is a wonderful, wonderful human being.
Yeah. Absolutely.
Thing that I know about literally everything that I know about oral surgery, about research, and about ethics in dentistry, he is the person who has taught me all of that.
Yeah.
My very first research project was in my final year of dental school, was supervised by him,
Yeah.
and just last month I did another research project with him.
Yeah.
So it's always a delight. It's always a delightful experience to work with him, and you always learn so much more.
Yeah.
um, Also the person who was constantly there for me, the person who motivated me, encouraged me to pursue my goals, quite literally the only one, I would say.
Yeah.
And he believed in me to achieve all of that. I
Perfect.
think he inculcated a sort of confidence in me that really changed me as a person, and
Mm-hmm.
that really changed my outlook towards my future.
Okay.
And
So,
every that
uh, building on this question, how important is it to have a right mentor in your early years as a dentist so that you could actually progress as a dentist?
I think it is one of the most important
Yep.
factors. I
Absolutely.
find myself lucky enough to have had Dr. Samir Ghazi. But mentors like him are honestly very rare,
Mm-hmm.
especially in the dental fraternity in Pakistan. And the thing is that in your early years, as a young dentist, or when you're going through dental school, you need a direction. You need
Absolutely.
someone tell you what next step to take, because
Absolutely.
frankly we're clueless. Without that direction in life, I don't think that you're able to achieve much, unless of course you have dentists in the family, and
Absolutely.
not everybody has that, right? So I think I'm fortunate enough to have had that mentor,
Yeah.
but not everyone has a chance to.
Perfect. Okay. So, okay, let's talk a bit about the current crisis at hand, COVID-19. None of us knew that something like this would affect our profession so much. Just a brief outline of what do you think the future of dentistry is and how will dentistry change?
Right. Like you said, nobody could have envisioned a situation which
Hmm.
put such a long period of interruption to provision of dental services across.
Absolutely. Yeah.
No dental community throughout the world was prepared for this.
Yep.
Um, it's At this point, it is difficult to say what the future holds for dentistry. However, we can sort of learn from the history. So, the deadliest pandemic to ever hit mankind was the Spanish flu in 1918.
Yep.
At the same time, there was a World War I going on. So, there were
Hmm.
two calamities, right? And then studies show how did it affect people. So of course there was an economic crisis, of course there was increase in poverty, and there was a negative effect on the capital returns.
Yep.
But one thing studies showed was that there was no discernible effect on the earnings, right?
Hmm.
What I believe in the near future is that there is going to be a greater impact on certain specialties of dentistry as
Hmm.
compared to others. For
Okay.
example, orthodontics or aesthetic dentistry. Why is that so, right? So, with the economic crisis, people are going to become more focused on going to dentists or getting, or just for the sake of getting emergency procedures done or things that really matter to them.
Hmm.
Over the past few years, dentistry has evolved and become very focused towards cosmetic procedures and aesthetics.
Absolutely.
I
Absolutely.
think given the COVID situation and the pandemic and the economic crisis, I think there's going to be a reverting back to the basics. That
Hmm.
is, industry focused mainly on alleviation procedures involving alleviation of pain or the
Hmm.
provision of this,
Okay.
right? So that's what I believe, but I do not think that we should be pessimistic about the future of dentistry as a
Hmm.
whole or as.
Okay, perfect, beautiful. Okay, so we're moving towards the end part of our interview. One of our last questions to you. If someone like me, like many of my colleagues who are just young dentists, fresh graduates, or just graduating soon, they're in their final year or third year BDS, and they aspire to go for DDS or any other dental degree abroad, what would your advice be to them considering COVID-19?
Right. So because I'm going through this phase myself right now,
Yeah,
I am applying to schools for admission into an advanced placement DDS program for international dentists here in the US.
yeah.
Uh, I'm aware of the situation right now. And what I can see is that it has not, so the COVID 19, the pandemic, has not impacted the educational opportunities present for international dentists.
Okay.
Yes, of course, the process it has impacted. There are other factors that come into play. Dental education is the most expensive education throughout the world, right?
Yep.
And of course, with the economic crisis, there's going to be the question of affordability that comes into play. There
Absolutely.
be the factors, the travel restrictions and the banning of visas that come into play. So that is
Absolutely.
definitely, but in the US at least, there is not in itself the educational opportunities
Mm-hmm.
for internationals have not decreased. In
Okay.
fact, I'd like to share an interesting fact with you that
Mm-hmm.
in US, by 2020, there is expected to be a shortage of dentists.
Okay.
That is going to open up opportunities, a lot of uh, opportunities for international dentists,
Okay.
right? Now, during this time, I know it's a time of uncertainty for young dentists, for myself as well. But I think what needs to be done is that you should, and all the young dentists should really focus on your goals, what it is that you want to do. And if you want to go abroad or attend a program, I would say that you should set a priority in what region do you plan to pursue your career, whether
Mm-hmm.
US, UK, or any other country, but you should not become fixated on it. I
Okay.
mean, you should keep other avenues and other windows of opportunity open.
Perfect.
And since right now we're under lockdown and everyone is staying home, this is a perfect opportunity to actually start working on your resume, because
Yeah.
whatever part of the world you want to pursue your career in, what matters is your resume. So
Okay.
whether it's learning how to perform a research or studying for your exams, say national board exams or your overseas registration exams, I think now is the time that you can work on all of these things.
Okay, Nuran, I know this wasn't a part of the questionnaire, but just a small question because you just mentioned resumes. How how should a young dentist start working on resumes if you just wanted to touch that question briefly so that people could know how to work on them during the pandemic?
Right. So, well, during the pandemic, we can't go in, we don't have access to healthcare facilities and all of that. I
Absolutely.
think one way would be to do online educational courses, continuing
Mm-hmm.
education, right? That's something that looks great on the resume. Second thing is again research. Learn
Yeah.
how to perform research, and it doesn't have to be, it doesn't have to be a clinical trial or even an observational research. You can start by, doing something as simple as, an systematic analysis,
Yep.
which is you have everything with you and you do an analysis and you can just send it for publication, right?
Yeah.
So you from that. Another thing that is important is, of course, community service.
Right.
So at this point, although you cannot actually go and provide dental treatment, you
Yeah.
can make aware of about the different precautions that they need to take when it comes to getting dental treatment done during the pandemic,
Hmm.
right? So that, of course, also counts as community service. I think these are a couple of things that while you're staying at home, you can do and build your resume that way.
Perfect. Perfect. Okay. So our last question. What do you think about this startup of ours and any advice, last advice that you would like to give us?
Right. So I've already communicated this to you before,
Yeah.
but I think the great initiatives, especially for Pakistani dental fraternity, because we need awareness from dental professionals in different parts of the world, how dentistry is practiced there,
Yeah.
break that tunnel vision and being fixated on, things that we do and doing it our own way, how we've always done.
Yep.
So I think, it is something that we needed in this pandemic,
Yeah.
and more so for, recent graduates, young dentists during these times of uncertainty who are trying to figure out how things would be in the future. I think it's a very reassuring platform for them,
Perfect.
and this way they can connect with the right people, and actually who can mentor them and find mentors even.
Yep.
So I would like to commend you on this startup. I think
Thank you.
it's a wonderful venture, and I want to wish you good luck with it.
Thank you.
And
Thank you. Thank you so much, Nuran. Thank you so much for taking time out for us from your busy schedule. You've been very busy, I know that. But thank you so much. And I hope you enjoyed the interview.
of course, I'm happy to be here. Thank you so much.
Thank you. Take care and stay safe.
Okay, goodbye.
Bye.